I think every single night there are just thousands of people sitting up in bed with the glow of a laptop screen lighting up a dark room.
Oh, absolutely. Just quietly opening dozens of browser tabs.
Right. They're trying to sift through medical forums,
Mm.
translating clinic websites, and really just trying to figure out where to even begin with a process that feels incredibly overwhelming.
Yeah, and a lot of people research this quietly before they talk about it.
They really do. They're looking for answers about a journey that is, well, deeply personal, often misunderstood, and honestly heavily clouded by misinformation.
Which is exactly why we're cutting through that noise today. Our focus for this deep dive is navigating the journey of breast augmentation in Mexico.
Yes, and to do this, we're drawing on a really comprehensive stack of sources. We've got detailed patient guides, clinical data on medical tourism, verified testimonials, and extensive resources from PlacidWay Pulse.
And just to be clear up front, the mission here isn't to push anyone toward a procedure. The goal is to take this massive, kind of intimidating topic and ground it in facts, medical science, and human reality.
Because that's such a personal decision, before we even get into the logistics of international travel or medical accreditations, we really have to look at the emotional catalyst.
Right, because this isn't usually some spur-of-the-moment choice made after, scrolling through social media.
No, not at all. Based on the data in our sources, it's about feeling confident, feeling balanced, and ultimately feeling comfortable in a body that might have gone through some really intense changes.
The underlying motivations are profound. I mean, when you look at the patient demographics in the PlacidWay Pulse resources, the primary drivers are significant life events.
Like what specifically?
Well, we see a massive number of patients navigating post-pregnancy body changes. For one, a body can perform the incredible, physically demanding task of carrying and delivering a child, but the physical aftermath.
The loss of volume or changes in elasticity.
Exactly. That can leave a person feeling completely disconnected from their own reflection. We also see this after significant weight loss, or just as part of the natural aging process, or even for those who have simply dealt with a lifelong physical asymmetry.
To kind of ground this in a real-world context, let's look at a patient-style story from the clinical data. We'll call her Maria.
And just to clarify, Maria is a sample fictional patient created to help us visualize this journey. It's not guaranteeing any specific medical results.
Right, exactly. But her profile is incredibly common. Maria has been carrying this quiet desire for years. She had children in her early 30s, her body changed, and she just wants a natural, confident result.
She isn't looking for some dramatic, unrecognizable alteration to her silhouette.
No, she just wants her exterior to reflect how vibrant and capable she feels inside. But okay, let's unpack this for a second because I constantly see a psychological hurdle mentioned in these patient guides.
The guilt factor.
Yes. Do patients like Maria often feel a sense of guilt or think it's frivolous for wanting this? I tend to view it like restoring a beautiful classic house.
Oh, that's an interesting way to put it.
Right. Like you spend years making sure the foundation is rock solid, the plumbing works,
Yeah.
and the inside is full of love and care. But if the paint on the siding is peeling and the front porch is sagging, you fix it.
Yeah, you maintain it.
Exactly. It isn't about changing the soul of the house. It's about making the outside reflect the care that exists on the inside. Yet there seems to be this lingering idea that wanting cosmetic restoration is somehow shallow.
Well, what's fascinating here is that the psychological relief patients experience post-surgery often rivals the actual physical change.
Yeah, like just the mental relief.
Yeah, because the mental weight of that disconnect, feeling like you are hiding your body or avoiding certain clothes or just feeling self-conscious at the beach, it's an incredibly heavy burden.
Oh, I can imagine.
So when a patient realizes they are allowed to want to feel good in their clothes and feel balanced, that guilt just begins to dissipate. This is not about rushing, it's about feeling informed.
Yes, I love that.
It's about validating that the desire to feel at home in your own skin is a completely legitimate healthcare goal.
So true. And once a patient works through that emotional hurdle and decides they are ready to explore their options, the very first practical barrier is accessibility.
Which is daunting. Finding high-quality, comprehensive care isn't easy.
No, it's not, which is why we are seeing a massive shift in the medical landscape. Patients are increasingly looking across the border. Mexico has really become a primary global hub for cosmetic surgery.
It has. The sources specifically highlight border cities like Tijuana and Mexicali, which are geographically so convenient for North American patients.
Right, alongside major centers like Cancun and Mexico City.
But we need to analyze why that shift is happening and go beyond the surface-level assumptions. Well, the cost differential is undeniably a factor. I mean, the data shows procedures ranging from $3,500 to $7,000 in Mexico.
Compared to averages of $8,000 to over $12,000 in the U.S. and Canada. That's huge.
It is, but a lower price tag alone does not create a thriving medical tourism industry.
Right.
The real driver is that Mexico has intentionally built a highly sophisticated medical infrastructure designed to attract international patients.
See, I want to push back on that a little bit, because the immediate question that pops into anyone's head when they hear those price differences is about compromise.
Naturally, yeah.
Like if I buy a piece of technology for half the standard price, I assume it's counterfeit or missing crucial components. Are patients treating safety or the quality of the materials for that accessibility?
It's a fair question, but the answer lies in healthcare economics, not in medical shortcuts.
How so?
The cost of delivering healthcare in the United States or Canada is heavily inflated by the ecosystem itself, not necessarily the actual medical materials.
Oh, like insurance and admin costs.
Exactly. In the U.S., the overhead for running a clinic includes massive administrative burdens for insurance billing, astronomically high real estate costs, and critically, a highly litigious environment that forces surgeons to pay exorbitant malpractice insurance premiums.
Wow, okay. And Mexico's different.
Very. Mexican clinics operate in a different legal and economic structure. Their base operational overhead is just a fraction of the cost.
So that allows them to offer premium care at a lower price point.
Yes, while using the exact same FDA-approved materials like Mentor or Allergan implants that you would find in a Beverly Hills clinic.
That makes so much sense. And the sources back that up by highlighting specific, highly rated facilities. You have Dr. Alejandro Paredes and Dr. Miguel Angel Fernandez operating in Mexicali.
And down in Tijuana, there's Guerrero Plastic Surgery and Brenda Arcos. The documentation shows these are established professionals.
But how does a patient actually verify that? Because the patient guides mention acronyms like AMCPER, JCI, and AAASF. To a layman, that's just alphabet soup.
It really is. But breaking down those acronyms is essential for patient safety.
Okay, what do those letters actually mean for a patient lying on an operating table?
Well, AMCPER is the Mexican Association of Plastic, Aesthetic, and Reconstructive Surgery. Gaining board certification through them is not just a matter of paying a membership fee.
It's actual medical training.
Rigorous training. It requires completing years of general surgery residency, followed by a specialized residency in plastic surgery, and passing continuous board examinations.
Oh, wow. Okay, and what about the facilities themselves?
That's where JCI comes in. It stands for Joint Commission International. When a hospital earns a JCI accreditation, it means independent auditors have scrutinized literally everything.
Like what?
They test the HVAC systems to ensure sterile airflow in the operating rooms. They audit the sterilization protocols for surgical instruments and review how medications are tracked from the pharmacy directly to the patient.
That is incredibly thorough. And AAASF?
It's a similar international body, but it's focused specifically on outpatient surgical facilities.
Okay, knowing that the infrastructure is so heavily regulated gives a lot of peace of mind. But a state-of-the-art facility is really just the stage. The actual outcome of the surgery comes down to the specific medical choices made between the patient and the surgeon.
Yes, and navigating those physical choices requires understanding the mechanics of the implants themselves. Historically, the primary choice was between saline and traditional silicone.
Right, which most people have heard of.
Yeah. Saline implants consist of a silicone shell that is inserted empty and then filled with sterile salt water during the procedure. The mechanical advantage there is that it requires a slightly smaller initial incision.
But the technology has moved on from that, hasn't it?
Dramatically. Modern cohesive gel implants, often referred to in the industry as gummy bear implants, have entirely changed the landscape.
Okay, I see that term gummy bear all over the PlacidWay Pulse resources. Can you explain the actual mechanism there? Because traditional silicone always conjures up images of like liquid filling that could leak.
Right, which was a real concern with older implants. But the term gummy bear refers to the chemical structure of the new silicone gel. In these advanced implants, the silicone molecules are cross-linked.
What does cross-linked mean in practice?
It means that instead of behaving like a thick liquid inside a shell, the material behaves like a cohesive solid. If you were to take a scalpel and cut one of these implants entirely in half.
The gel wouldn't spill out.
It wouldn't spill out at all. It would hold its shape perfectly, much like a gummy candy.
That's wild.
It is. And this cross-linked matrix provides a highly natural look and feel, and it maintains the shape of the breast over time far better than older technologies.
They cost more.
They do affect the overall cost of the package due to the advanced manufacturing process, but they really are the standard for natural results now.
Got it. So with technology like that available, the consultation phase becomes super critical. A good consultation should feel like a conversation, not a sales pitch. You aren't just walking into a clinic and ordering off a menu.
No, you can't just say you want a size 4 gummy bear implant and expect them to say yes. A verified, board-certified surgeon approaches the consultation as a structural assessment.
Meaning you're measuring your actual anatomy.
Exactly. They have to measure the base width of your chest wall, assess the elasticity and thickness of your breast tissue, and evaluate the placement of your inframammary fold, which is the crease under the breast.
Oh, because what looks beautifully proportioned on someone with a wide chest wall might look entirely unnatural on someone with a narrower frame.
Unnatural, and it could actually cause tissue damage.
Here's where it gets really interesting, though, because the digital age has changed how we approach aesthetics. What happens when a patient walks into a clinic in Tijuana, pulls up a heavily edited photo on their phone, and just demands a specific, massive volume that simply does not fit their anatomy?
It happens all the time.
Right. I look at it like taking a delicate piece of vintage silk to a master tailor and demanding they sew it into a heavy winter trench coat.
That's a great analogy.
The material physically cannot support the structure. A true professional has to say no. So do these surgeons actually push back?
They do, and they are medically obligated to push back. If a surgeon agrees to place an implant that is too large or too wide for the patient's natural tissue envelope, the mechanics of the body will simply fail.
Like the skin stretches too much?
Yes, the tissue will thin out over time. That leads to visible rippling, stretch marks, or even the implant becoming palpable right beneath the skin.
Oh, wow. That sounds awful.
It's not a good outcome. A reputable surgeon prioritizes your long-term health and the longevity of the result over a short-term aesthetic request. They will explain the anatomical limitations and guide the patient toward a volume and profile that harmonizes with their specific body mechanics.
Okay, so that structural understanding naturally transitions us into the logistical reality of the trip itself. Let's say Maria has found her surgeon. They are completely aligned on the medical plan, and she is ready to travel. The PlacidWay resources detail that clinics in Mexico cater to medical tourists by offering comprehensive treatment packages. But the term all-inclusive can be very misleading, right?
Very. The medical definition of a treatment package is very different from the hospitality definition.
So what is actually covered?
The patient guides explicitly break this down. A standard comprehensive package includes the core medical ecosystem. So that's the primary surgeon's fees, the anesthesiologist's specialized fees, the cost of the physical implants, the operating room time.
Okay, all the actual surgery stuff.
Right, plus all necessary preoperative blood panels and cardiovascular tests, post-operative medications to manage pain and prevent infection, and the surgical support garments required for healing.
Furthermore, because these clinics are dealing with international patients, many of these packages bundle in logistical support too. Like, they arrange for ground transportation, picking the patient up directly from the airport in San Diego or Tijuana,
And taking them to a partner hotel or a dedicated medical recovery house.
So should a patient view this like booking an all-inclusive resort vacation?
No, and this raises an important question regarding mindset. Patients must remain intensely detail-oriented. A medical journey requires a forensic review of the itinerary.
You really have to read the fine print.
Absolutely. You need to know exactly what the package excludes. Does the provided accommodation cover the cost of a travel companion?
Oh, good point.
Are specialized meals included at the recovery house, or do you need to arrange food delivery? If your body requires an extra day of observation in the clinic before you are cleared to move to the hotel, is that billed separately?
Right. Assuming everything is covered is just a dangerous approach.
It really is.
And the logistics of where you sleep and how you get your meals are paramount because the surgery is merely the starting line. The actual journey, the part that demands physical endurance and emotional patience, is the recovery phase.
And the timeline laid out in the medical data is sobering. The physiological healing process cannot be rushed.
The sources dictate a minimum stay in Mexico of 1 to 4 weeks, highly dependent on the surgical technique used and the surgeon's post-operative assessment.
Yeah, and patients often wonder why they can't simply fly home the morning after a successful procedure. The mechanism behind that restriction is actually cabin pressure.
Oh, interesting. Because commercial aircraft's cabins are pressurized, but not to sea level.
Exactly. The slight drop in pressure causes gases in the body to expand, which can dramatically increase swelling, put dangerous tension on fresh surgical incisions, and elevate the risk of deep vein thrombosis after being under general anesthesia.
That makes total sense.
Mm.
And the immediate reality of those first few days involves intense swelling, managing discomfort, and wearing a specialized compression bra 24 hours a day to ensure the implants settle correctly.
Into the pockets the surgeon created, yes.
To understand what that actually feels like, we can look at the verified patient testimonials and the sources.
They're so helpful for getting a real perspective.
They really are. Lisa Farinick traveled to Mexicali to see Dr. Paredes. She highlighted the absolute necessity of the after-hours support team, noting that the meticulous nursing care was vital during those vulnerable first nights.
And then there's Shannon Ayers, who traveled to Tijuana for Dr. Guerrero.
Right. She mentioned being incredibly nervous about the whole process, but she noted how the tidy, precise incision work and the constant comforting check-ins entirely alleviated her fear.
But isn't it terrifying to recover in a different country, away from your own bed?
You'd think so, but the data reveals an unexpected psychological benefit. We call it forced rest.
Oh, I like that term, forced rest.
Yeah, because when you recover in your own home, the cognitive load of your daily life is just staring you in the face. You see the dishes in the sink, you hear the dog barking, you feel this pressure to return to your normal routine before your tissue has actually healed.
That is so true. But at a dedicated recovery house in Mexico, staffed by nurses managing your medication schedule, your sole responsibility is cellular repair.
I completely see the value in that isolation. But patients also need to bridge that gap back to reality. The patient guides offer highly practical advice for managing the distance.
Like securing a local Mexican SIM card or setting up an international data plan immediately?
Yes, you need seamless access to WhatsApp to update your family, but more importantly, to send photos of your incisions to your surgical team.
Establishing those communication protocols before you even enter the operating room is vital. The patient must have a clear chain of command for when they return to the United States or Canada.
Right. If they experience an unexpected spike in swelling on a Sunday afternoon 3 weeks after the surgery, they need to know exactly which number to dial to reach their surgeon's on-call staff.
When you lay out all these moving parts, understanding the macroeconomic reasons for the price, translating the accreditation acronyms, learning the molecular structure of cohesive gel implants.
Plus, managing the logistics of a cross-border trip and mapping out a weeks-long recovery timeline.
The cognitive load is staggering. It is incredibly easy to hit a wall of decision fatigue. You are essentially trying to act as your own medical researcher, international travel agent, and postoperative nurse simultaneously.
The vulnerability of the patient in that research phase is just very high. Wading through conflicting reviews on anonymous forums or trying to verify a clinic safety record through a translated web page often leads to paralysis.
Patients need a structured mechanism to organize the data.
And that's where PlacidWay can help patients compare options. The resources we've been pulling from today, specifically PlacidWay Pulse, are built to address that exact bottleneck.
It is a dedicated platform designed to bring order to the chaos of medical tourism research. The utility of the platform lies in its aggregation of verified data.
So it allows a patient to systematically explore breast augmentation providers in Mexico using standardized metrics.
Exactly. You can read verified patient experiences, compare the granular line item details of different treatment packages side by side, and most importantly, request a free quote directly from the providers to understand exactly how your unique anatomical needs translate into a logistical plan.
So what does this all mean? I view the platform essentially like a compass in an incredibly dense, overgrown forest.
I like that analogy.
The compass is not going to chop down the trees for you, and it certainly isn't going to walk the paths for you. You are the one who has to undertake the journey and do the work of recovery.
Right, but the compass points you directly toward the vetted, verified routes. It prevents you from walking in circles through endless search engine results, allowing you to start meaningful, direct conversations with accredited medical professionals.
By organizing the information, you fundamentally alter the power dynamic. You remove the fear and uncertainty that comes from a lack of transparency, and you replace it with empowered, practical decision-making.
When a patient can clearly evaluate the surgeon's specific AMCPER credentials, verify the facility's JCI accreditation, and understand the exact inclusions of the recovery package all in one place.
They transition from being an overwhelmed researcher into an informed, autonomous patient.
Yeah,
That transition back to autonomy is really the heart of this entire deep dive.
it really is.
We started by talking about the emotional catalyst, the desire to align the physical reflection in the mirror with the internal sense of self. The journey to achieve that alignment requires navigating complex medical science and international logistics, but the destination is bodily comfort.
And if we connect this to the bigger picture, the phenomenon of medical tourism, particularly for deeply personal cosmetic procedures, represents a profound shift in how we view healthcare access.
It really does change everything.
Historically, high-quality, specialized medical care was heavily restricted by geographical borders and domestic economic structures. But by meticulously researching and crossing those borders, patients are refusing to let geography dictate their well-being.
They are taking ultimate control over their own self-image, actively rewriting the rules of how, where, and when they seek out self-care.
That is an incredibly powerful thought to leave on, breaking down the barriers to take control of your own comfort and confidence.
Because ultimately it is your body, and you deserve to feel completely supported and safe from that very first quiet internet search late at night all the way through to your final day of recovery. If this topic connects with your goals, explore breast augmentation providers in Mexico, compare options, and request a free quote through PlacidWay when you are ready. Thank you for trusting us with your time today, and keep exploring your options with clarity and confidence.